that's the fun thing about medicine. There's so many opportunities within it to do different specialties, of course, but also different ways to help people, as you mentioned.
Hello, everyone. I am very excited once again because we have a wonderful doctor, Dr. Amit Pandey, and we're going to have a great conversation today. So tune in, share it with your friends, all of those kinds of things. We're just going to start by having you tell us a little bit about yourself and your journey to medicine.
Yeah, absolutely. First of all, I just want to say thank you for having me on. I'm really excited to be here. And I wanted to preface it by saying that I'm definitely really passionate about giving back to future aspiring physicians and young pre-meds and young student doctors. So this is a great, chance for me to give back to that community. So thanks for having me. So I am an internal medicine hospitalist in San Diego, California, and I'm currently chief of the Division of Hospital Medicine at Sharp Memorial Hospital. Many may be aware, but for those who don't know, hospital medicine is basically physicians who work exclusively in the hospital taking care of patients admitted from the ER to the hospital for a multitude of medical issues. So that's what I do. I love what I do. And I've been in practice about 5 years or so. I'm in San Diego. I'm a Southern California guy through and through. I've been pretty lucky to stay around here for education and training and then practice now. And I live here with my wife. My family's close by. Outside of work, I love to write, which we'll talk about in a few minutes. And I'm pretty active, love to play basketball, and of course, definitely love taking care of my patients.
That's awesome. So as you mentioned, you love to write, and you recently wrote a book called The Pre-Med Paradox. Can you tell us about it and what inspired you to write it?
Yeah, so really excited to talk about it. So The Pre-Med Paradox, what you need to know about the life of a physician, that's the full title. And so it's a project that kind of started with journaling some of my experiences about some of the most memorable patient encounters I had had over my years in the hospital. And then I slowly started to think about how could I put that together to give back to future doctors. So the goal of the book really is to help people get a comprehensive understanding of the experience of the life of a physician, all the way from the beginning, from pre-med through med school, residency, and to attending life, and years into attending life where I am now. And I found that in reflecting on my experience and how I got to where I am today, talking to a lot of my peers in the medical field, I had a lot of deja vu moments where I talked to a lot of my peers, and we were talking about the same topics and things that we experienced along the way that we may not have anticipated prior to coming into medicine. And it's impossible to know it all before you begin, of course, but I realized that there was an opportunity to help people understand more about what you actually see, feel, hear, the emotions, the ups and downs, and a lot of that kind of experiential component of life in medicine. And so that's how the idea kind of came together into a more cohesive into a book that I felt like I could hopefully give back to future doctors and help them understand a little bit more about what life would be like once they either entered the pre-med or medical school process or even got to life as an attending physician. So I'm pretty passionate, obviously, about that topic, and I feel the book can be sort of like a pseudo-mentor to students who might be hard to find that advice with a mentor, on a day-to-day basis. So this book can sort of act as a surrogate mentor in that way.
I love that, because I think like when I was thinking about becoming a doctor and all of those things, like we had some kind of books like The House of God, or we had the Atul Gawande books. And then of course the TV shows like ER and Grey's Anatomy, which are nothing like real life. And then we had shows like Scrubs, which are kind of like real life. But now we have to have like more of these stories coming forward, because as you mentioned, like when you talk with your friends and your colleagues, there are so many things that are very similar throughout our experiences, regardless of where we train and everything. And I think a lot of people who may be beginning their medical journey may think that they're alone. So it is good to kind of, like you said, have these stories to kind of bring it all together and let people know that you're not alone, you'll get through it, and you'll come out on the other side with all of this knowledge and just hopefully gratitude for being able to serve your patients.
Absolutely. I totally agree. I mean, I think that yeah, this is just like one of those moments again where I talked to my peers and a lot of the folks that I had either gone to med school with or worked with, and we had all this shared experiences of, you kind of have these piecemeal ways where you sort of try to put together an understanding of what life as a physician is like. Some of that is from shows like you talked about. I totally agree, by the way, that Scrubs was my favorite and the one that kind of depicted it in the most realistic way. But, it's just tough to truly get that perspective until you're there. And of course, having, clinical experience or volunteer work and mentorship from potentially a med student, resident, or even an attending, those are all very useful, but they can be hard to come by. And that experience and that connection can be tough to come by. So it's important to sort of try to get in touch with that experience and get a little bit of perspective about it before you begin. And I totally agree that once you go through the process, you look back, you have so much perspective, a lot of gratitude, absolutely, for everything that you've learned, all the growing that you've done, and the opportunity you have to use all those skills to help people. Because obviously, at the end of the day, I think the vast majority, if not all of us, started with that desire, right? Going into medicine for that reason. So yeah, I think talking about those experiences and sharing those and feeling not alone in the process is super important. I absolutely agree with you.
Absolutely. And now reflecting back to some of the experiences that you've had, is there a particular memorable moment that stands out to you as a physician?
Yeah, that's a great question. That's always such a tough one to answer because we have so many, right? And so many moments that are either very memorable or very poignant. It's odd because somehow many of them blend together, but at the same time, you have these moments that stick out. And one of them, so I definitely tried to touch on some of those in the book because I wanted to share, again, some of the practical nuts and bolts of what you will go through from a logistical practical standpoint, but also some of my experiences to help people sort of feel what I felt at those moments. One of them that's super memorable for me is the first time I ran a Code Blue, which is something that I talked about in the book. And so Code Blue, again, maybe for those who may not be as familiar, is the terminology that we use in the hospital. We call over the hospital PA system to notify that there's been an emergency and a patient has had a cardiac arrest, meaning that their heart has stopped beating. And unfortunately, that means they've passed away. And so what that activates is a team that goes to the patient's bedside to try to resuscitate them through what we call cardiopulmonary resuscitation, or CPR. So the first time I ever had the, privilege, I would say, but also responsibility that can be kind of anxiety inducing the first time you're doing it. That was super memorable for me. So as residents, we were on call to be the code leaders for the Code Blues. I had a patient whose heart stopped beating and we had to all sort of rush there. And I remember having to sort through those emotions of anxiety and nervousness, but also excitement because it's a awesome opportunity to potentially save a patient's life. And the really remarkable thing I think about a Code Blue is that there's a team of probably 10 plus people that end up arriving there to help the patient, multiple nurses, pharmacists, respiratory therapists helping the patient get breaths, anesthesiologist helping the patient get what we call an airway or connecting them to a ventilator. And then my role was to be the code leader, which is sort of the person who's assessing the situation, trying to understand what was the cause of the patient's cardiac arrest, and directing the whole team and sort of directing what medications would be administered and things of that nature. So you have to sort of, as you're probably familiar with, Erkeda, coordinate the team and keep a cool head and not get overwhelmed by the moment. So that was a really, really memorable moment for me just because of how highly charged and how high stakes it is. And I was lucky. We don't always have this good fortune, but we were lucky as a team to be able to resuscitate the patient. And they ended up going back to the ICU and recovering. And I got to see that patient on my ICU month recover and leave the hospital. So that was it really is one of those awesome moments that you can't forget as a medical trainee or a physician.
Absolutely. I think that everyone can kind of hopefully remember their first Code Blue. I remember mine, and it was not as smooth. I think I was an intern, and it was on nights. And for the listeners out there, usually, we have YouTube now, but you can't see all of me. And I'm 4'11". I'm pretty small. I'm about double the size I was intern year. And I tried to do the chest compressions. I got flipped across the room because I wasn't strong enough. Because you do all the training and you're like, okay, I can do this, blah, blah, blah. No. But going and being able to call the family and watch, I was watching my senior at the time kind of run it. It was a really touching moment just to be there during that person's time of need. And thankfully, they also were able to be resuscitated. But those kinds of moments stick with you for years afterwards and through your whole career. So it's good that you're able to share that with your audience, as well as kind of bring that perspective, because I know when students start their rotations and all of those kinds of things, you will be getting CPR training when you're about to go into intern year, like they make you redo it. And so you're like, yeah, I can do it. That's how I walked into it. And I was like, oh no, I can't do it on a real person. Yeah. So it was a very interesting experience.
100%. No, I know. I figured that you had a memorable, similar experience because you can't forget your first one, right? And I totally agree with you that something that's really unique about medical practice, I think, and probably true in other fields as well, but you learn so much, right, in your pre-med years for sure, but especially those first couple of years of medical school before you get onto the wards and the clinics and put that stuff into practice. And then you realize, wow, this can actually be a lot different maybe than what I learned on paper. And that's, so there's a practical component of learning how to put those skills into practice, whether it's procedures or something like CPR. And then there's just unexpected stuff that happens in medicine that you can never predict. And I think you touched on a really important thing too, which is, reaching out to the family, talking through, these sort of really life-changing moments really for both patients and their families, and being there to support them. I think that's another skill that you learn as you go as a physician, and it comes with time, like getting more comfortable with those experiences. So all those things put together sort of are multiple, aspects of the skill set of a doctor that are all fun to learn and very memorable, because sometimes you have some memorable missteps or memorable successes. That's part of the process.
Absolutely. So as you mentioned, we learn a lot of things in books and we shadow and we see things and then we get to put them into action. What is something that you wish that you knew before entering the field of medicine?
Yeah, that's a great question. When I look back, I think that I wish I had a little more perspective on how diverse the medical field is, both in obviously the practitioners and the people who go into medicine, but also the opportunities that you have within the field of medicine. And I think the reason I say that is I feel like I had this feeling, and maybe a lot of pre-meds can relate, that maybe when you're early in undergrad or even early in medical school, you feel this notion that you have to have it all figured out, right? You have to sort of know exactly what you want to do and what specialty you want to go into. And the reason I bring up that diversity of opportunity and diversity of different practices and specialties is that it's a process. Medicine and medical training is a big process, and you don't have to have it all figured out on day one. And I would say for pre-meds, for example, it's even really unique to look at healthcare as a whole and understand how many different healthcare professional roles there are. Being a physician is amazing, and I love what I do. There's also a lot of other great roles out there, like, pharmacist, dentist, nurse. My wife is an ICU nurse. So understanding the diversity in the field as a whole. And then if you do end up pursuing life as a physician, understanding there's so many different medical specialties that you may have notions as to what you want to do day one or even day 500 of medical school, but things may change. And that's okay. And I think maybe taking the pressure off of young aspiring doctors about having it all figured out on day one, and just opening yourself up to just learning and enjoying the process and finding what is best for you within that process, rather than necessarily having a for sure linear goal right in the beginning. And some folks do have that, and more power to them, and I think that's great. But I think it's good to be open-minded and not put that pressure on yourself early in the process.
I couldn't agree more. And just to kind of re-highlight the major 3 points that I got from what you were saying, I would definitely agree that sometimes we are searching for our why and we want to help people. So there are many ways to help people. So I always say, if you're thinking about going into medicine, specifically to become a physician, like, take a look at why you want to help people and how, because it's a long life commitment and a lot of time and all of those kind of things. So you want to be sure. So like you said, there are ways to help people through nursing. There are ways to help people through being a social worker or working in public health, so many different ways. So make sure that this way is right for you. And it's okay to even go and explore another career before you go and pursue medicine, because medicine's always going to be here. I would say the second thing that stood out to me would be, once you get into school, like, it's okay to have an idea of what you want to do, but that may change. So go into each rotation with an open mind, because you may have thought you wanted to be a pediatrician, but then you get to your ortho and you're like, wait a minute, am I an orthopod? Like, it's okay. Like, you can change your mind. And if you go into each rotation with an open mind, you're putting your best foot forward. I mean, worst case scenario is you learn everything that you'll never, ever see again, so that you can apply it to your friends, your family, or your patients that you see. Best case scenario, like, you might change your mind. And then the third thing I would say from that is, like you said, being adaptable and open to change, because you may go into a specific field and start your career and then realize, like, I want to do something else. It's okay to pivot. Like, you're not stuck. So I love that you mentioned all of those things, because I think, like you said, with shared experiences amongst the physician community, a lot of people have come to those points at some point in time in their life.
Totally. Yeah, no, I agree with all those points you reiterated. And I think understanding that things change throughout the course of a career, and that adaptability, and sort of giving yourself that freedom and that space to explore and not necessarily need to have everything figured out from the get-go, I think is really important. And I'm actually, like, I think probably most of us in medicine have examples of looking back on something that they thought they may have wanted to do. The example you gave, like, I thought I wanted to be an orthopod or an orthopedist, as you know, we call them orthopods in medicine, but orthopedic surgeon. And I got to my rotation and I just realized it wasn't right for me. And I still, exactly as you said, learned as much as I could and did the best that I could do on that rotation. But it was a learning experience in that I realized I liked other things better, and particularly medicine or medical specialties were more my cup of tea than surgery. But that's totally okay. And I think that's the fun thing about medicine. There's so many opportunities within it to do different specialties, of course, but also different ways to help people, as you mentioned. And even as a physician, you can do a lot of things like public health, global health, research, administration. There's a million different opportunities within medicine, even as a physician. So I think it's great. It's a very diverse field that has probably something for everybody who does end up pursuing it.
I couldn't agree more. Now we're coming almost to a close, but I have a question for you. Since you've been doing a lot of reflecting when you're writing your book and talking to a lot of other physicians, if you could start your medical journey all over again, is there anything that you would do differently?
Yeah, good question. So when I look back to my early medical years, I guess the book that I wrote was really targeted, the first component of it was targeted at that mental preparatory work that I think that is really helpful to do before you pursue medicine, which is what you mentioned, finding your why, right? So I talk about that a lot in the book in terms of what are the reasons that folks consider going into medicine, and what are some of your reasons, and try to explore your own values and your own reasons in doing so. So I think that's very important. But actually what came to mind when you asked that question was a little bit beyond that point, which was right when I got to medical school. And I think for me, and I think many med students may relate to this experience, that when I got to med school, to be honest with you, I had this feeling of sort of intimidation or just self-doubt, I would say, maybe self-doubt, that I had so many smart people around me, and I kept thinking to myself, wow, everybody's smarter than me. And there may have been some truth to that at some point, because obviously I had a bunch of really intelligent, motivated, and talented peers. But I think that we often end up feeling this feeling when we start medical training, because med school is hard. You're learning so much at such a rapid pace. You are surrounded by a lot of really talented and intelligent people. And although I think there's a lot more focus on student experience and creating a safe learning environment, there's always, it's hard to not be affected by some degree of self-comparison to others. So I would say, first of all, in med school, I would try to rid yourself of that notion, because as hard as it is, allowing yourself the ability to just go through med school and learn as much as you can and experience it without feeling that you have to achieve a certain metric or compare yourself to another student. I think that can really promote mental health and sort of like help people in terms of their well-being in medical school. And sort of piggybacking on that point, personally, I felt that because of that, I ended up focusing so much on study. And don't get me wrong, that's really important in medical school, of course, that you need to have well-trained, well-educated med students to become excellent physicians in the future and take good care of our patients. But I also feel like in medicine, there's so much opportunity in med school to do great things. If you have an interest, do some community outreach, you want to help a population in the city that you go to medical school, or you want to create an organization or do something innovative, you have a ton of resources at your fingertips in medical school. And I think I wish that I had tapped into that a bit more and thought a little bit more innovatively and been a leader in my medical school community and doing something that I felt was passionate about outside of medicine. So I'm doing that now with my book and trying to give back. But I think as a med student, remember that it's a process and don't get bogged down solely by the academics of it, because it's really overwhelming, but also really rewarding, and you learn a ton. And if you give yourself the opportunity for balance and to pursue other things, I think med school is actually an awesome experience. So that's what I would kind of do differently or give the advice to future med students.
I couldn't agree more. Well, I appreciate you coming and sharing your words of wisdom with the audience. I just want to give you an opportunity to say goodbye, tell people how they can find you and where they can find the book.
Yeah, so thanks again. Really appreciate you having me, and it was great chatting with you. So again, the book is called The Pre-Med Paradox, and you can find it on Amazon. There's a paperback version as well as an ebook. So either format is available, and it's also available on Kindle Unlimited. And then if you'd like to check out the website is www.thepremedparadox.com. And you can also find me on Instagram at The Pre-Med Paradox. And so feel free to reach out. Please, of course, check out the book. I really do feel that it will provide a lot of utility and help a lot of medical students and pre-meds. And feel free to reach out to me via DM on Instagram or on the website. I have my email, which is thepremedparadox@gmail.com. I'm passionate about helping future students, so would be happy to chat more.
Thank you so much for joining us. And for all of the students listening out there, we'll put those links in the show note. Reach out and definitely let us know here on our podcast how we can get more people on with topics that you want to hear about, or any particular guest that you want us to join. So you can also reach out to me on my Instagram at Dr. DeGram, DOCTOR, the letter DGRAM, and let us know. We'll see you again next week with another fantastic guest. Bye.
Each episode of the Prospective Doctor podcast is brought to you by Med School Coach. To access articles, videos, webinars, and free tools to help you succeed on your journey toward medical school and beyond, visit our website, prospectivedoctor.com. We hope you tune in again next time.